I'm very happy to be here. Thank you, Olivia, for the invitation. I'm glad you all could be here to talk about this very important and timely topic. Uh, so first, the good news, the joy of increased longevity. Uh, Public health advances in the world have allowed people to live much longer, healthier lives. Uh, Things like immunizations, motor vehicle safety, fewer people dying of heart disease. This has made a huge difference in our world. So now in the US, you're born, you're expected to live almost 80 years. And if you survive to 65 and you're a man, you have 17 years of expected life ahead, 20 if you're a woman. And older adults are very active contributing members to society. So current statistics, 80% of adults 65 to 74 are either working, volunteering, or providing free caregiving for their families. The number is still the majority of 75-year-olds and up are still contributing to society in these ways. And demographically, the older ages are set to explode. All the population is growing across the demographics. You can see that here. But which demographic is growing? It's expected to grow the most over the next 40 years. By far, the older demographic. In the US, it's expected to double in size from 2010 to 2050, nearly triple in size around the world. So I'm glad we're all here on this topic. It's very important. So now the bad news. So as people age, research documents problems with financial decision making. So bankruptcy filings are growing fastest among the older demographic. Studies show suboptimal credit behavior increases past age 53. Older adults exhibit less investment skill, and financial literacy scores decline with age. So these studies all look at across the generations performance. And the evidence is not suggestive of any good news for financial decision making at older ages. So my work and what I want to spend most time in is what happens within individuals. So within a generation, what's happening as we age. So as Wendy already introduced the idea, fluid intelligence, we're all in this room on the downward slope. But the good news is that we're still all on the upward slope of crystallized intelligence. So crystallized intelligence, that is learning from experience. And fluid intelligence, that's our quick on your feet thinking ability. These combine to produce cognitive performance, which is what really matters. And studies suggest those performance peaks around age 50. So this graphic is from the Age of Reasoning paper, which is a brilliant paper on this subject, where they, in their study, this is a suboptimal credit behavior study, they found the peak in performance at age 53. So normal aging is considered some decline in overall cognitive performance or ability. That's considered normal aging. And there really isn't a problem with normal aging. The real problem comes in the diagnosed cognitive impairments. So there's what's called preclinical cognitive impairment, where it's only really noticed by the individual. The doctor is probably not going to notice. People around them, friends and family, are probably not going to notice. If things progress past the preclinical stage, you can get to MCI. This is mild cognitive impairment. So in the mild cognitive impairment stage, the individual almost certainly notices some changes in their cognitive performance. Their friends and family probably notices some changes. But those with mild cognitive impairment, for the most part, can maintain their activities of daily living. The really scary stuff is if it progresses, the cognitive decline progresses past mild cognitive impairment into the dementia stage. This is where there are various levels, but things can be very severe and disrupt the activities of daily living. So my research has been done with the Rush Memory and Aging Project. This is a project run by researchers at the Rush University Medical Center. Started in 1997. They enroll participants age 60 and up, and they enroll at any age 60 and up. Mean age currently is 82, so this is a group of older people from the Chicago area. They do yearly interviews and clinical evaluations, very extensive data gathering and testing. We know demographics, we know cognitive performance in great detail, and this is done yearly within individuals, so we can see how individuals themselves are changing over time, not just how different generations perform. And then in 2010, they added health literacy, financial literacy questions, questions about their confidence in their financial decision-making, risk preference questions, a test of have you experienced financial fraud, a measure of scam susceptibility, and they're testing these each year within these individuals. So the work I've done, we had 787 participants without dementia. There are participants in the study with dementia, but my research focuses on those without diagnosed dementia. And I'll point out that 12% of them have experienced financial fraud. So looking at individual cognitive performance, you see wide variation. The good news is that up here at the top, what you're seeing, the people at the very top, those are the best cognitive performers. This is a graph with a Z-score of cognitive performance that's capturing all of the cognitive tests done in this study. And then on the horizontal axis, you see the number of years in the study. And the good news is that there are people aging in this project that show almost no decline, and you can even see a few increasers in cognitive performance there. And that's to be expected from some practice effects. When you take these tests every year, you can get pretty good at them. But despite practice effects, you see that the general trajectory is negative. The blue line is capturing the average trajectory of those who have not been diagnosed with mild cognitive impairment. So the black line is capturing the average trajectory of those who have been diagnosed at some point with mild cognitive impairment, at least, and potentially more so. So you can see that individual cognitive performance doesn't just always fit the average. There are people that age for decades with no loss in cognitive performance. And then there are people who things are going fine for them before it's like cognitively they fall off a cliff and their cognitive performance is falling standard deviations down. So we ask several numeracy questions, several knowledge questions to capture financial literacy, just to give you a taste of those. A numeracy question, if the chance of getting a disease is 10%, how many people out of 1,000 would be expected to get the disease? A taste of the financial knowledge questions, true or false, to make money in the stock market, you have to buy and sell stocks often. That is false. It is. So this is the type of information we're gathering about their financial literacy. So what do we find? So we find in the work we've done, individual declining cognition predicts declines in both financial literacy, that's both numeracy and knowledge ability. In particular, we found that episodic memory of events you experienced in your life, and visuospatial ability, those declines point to significant declines in numeracy, declines in semantic memory, which is memory of kind of rote textbook knowledge that you learned, you didn't necessarily experience. Declines in semantic memory point to financial knowledge declines. So individual decline in cognition is associated with a drop in self-confidence in general. We ask them to report that. They say, with cognitive impairment, they say, I'm not as self-confident in general. But we ask them about their confidence in managing their own money, and there's no effect there in the data, which says that even though they recognize a general decline in their confidence, when you ask me about my money, I'm just fine, thank you, stay out of my money. The implication for this that's important, especially for doctors and I think caregivers too, is that it can be very sensitive to ask people about their money. They may not want to tell you anything, but we can show data-wise, research-based evidence that when you ask things about people's memory, you're learning about their financial literacy indirectly as well. We did find those who are experiencing these cognitive declines are more likely to get help with their financial decision making, which is good news. But still, there are many in the study. We observe these declines, but they're not getting any help with their financial decisions. Elder financial fraud is a huge problem in this country. It's a significantly growing problem that needs to be addressed. So various statistics on the costs. MetLife did a study in 2011, looked at published fraud reports. So they estimated the cost at $3 billion per year in the US. Of course, there's an underreporting problem. A lot of people experience fraud and don't tell anybody. They don't want anyone to know. A more recent study by TrueLink looked at surveys of seniors and caregivers, and they find much more prevalence of fraud, estimate $36 billion a year. Numerous scams target seniors in particular. So we also looked at fraud in this data. We have in the study cognitive performance over several years before we even introduced the decision-making component of the study. So we can use the cognitive trajectory to predict what happens to fraud. So in the study, we focus on a subsample of people experiencing declines. So we threw out the small number of people who show improved cognitive performance over time. We also threw out those with dementia. That certainly, I think, is relevant to fraud, but it's hard to even get good data from those with dementia. A lot of them don't even finish the decision-making study. They just can't answer it and won't do it anymore. So they're thrown out as well. We're comparing those with slight declines considered normal aging to those with bigger declines that go only as far as mild cognitive impairment, and we found that fraud odds increased by 1/3 as you move down the cognitive performance slide. So cognition seems to be affecting fraud incidents. Maybe it's that fraudsters are more attracted to people with cognitive decline. Maybe it's a supply side effect. Well, we can't really test that, but we can in our data test a more demand side effect of, are these individuals more susceptible to scams? And we find that they are. It's significantly higher with greater cognitive decline. So what are the implications? You can indirectly test for financial fraud vulnerability by observing cognitive decline. I think this motivates earlier financial intervention is needed to forestall the problem of fraud. We also had a nice measure of overconfidence in the study where when they did this literacy knowledge test, we asked them after every question, how confident are you in your answer? So we could distinguish those who didn't have good financial literacy but knew they didn't have good financial literacy from those who didn't have good financial literacy but thought they had great financial literacy. And that's how we capture overconfidence. And we find that overconfidence is a strong predictor of fraud incidents. So it's not just having low literacy, but it's the combination of having low literacy but thinking you have high literacy, which I think points to possible education to boost literacy to help this, or just boost awareness that maybe your literacy isn't quite as good as it used to be. We also measure risk-taking, the simple 50-50 chance of either doubling your income or cutting it by 10%, which that on the surface sounds great. I want that gamble. But the problem is if someone's offering you this type of gamble, they're probably trying to scam you. This is not a realistic gamble to encounter in the world. If we ask them, would you take this risk? The scary result is that those who have experienced fraud, the next time we ask them, are much more inclined to want to take this risk, especially compared to propensity-matched non-victims. So similar, otherwise, people who didn't experience fraud, no change in this, but those who experienced fraud say, oh, I like this gamble. The problem is that exposes you to repeat victimization. There is a problem called the recovery scam, which is really insidious. They go after people, seniors who have experienced fraud, and say, I want to help you. I can help you recover your losses. And they're just scamming them further. So where does this leave us? I think with many key outstanding questions, big questions that research should address in this area. So what's the prevalence and cost of poor financial decision making? Some areas have been looked at. There are many others that need to. How are people preparing for their financial futures now compared to how should they be preparing for those financial futures? What should the market do to respond to these demographic events and this information about what's happening to cognition and financial decision making? And then what's the proper role for government in this area? I think all big open questions.